Hi, I'm good, Dr. Hadiza. How are you today?
Fine. I'm glad to be here.
Yeah, I'm glad you're here as well. Thank you so much for joining Coffee Chats with Professionals. And it's been amazing interacting with you, scheduling this meeting. And of course, again, I thank you for your time. All right. So, yeah, let's start. I do have my coffee cup, so I'm just gonna be sipping.
Mine is here as well. Let me
Oh,
take a
lovely.
sip.
That's great. So let's start from the beginning. Let's talk about yourself. Can you tell us how you got into healthcare? Because we can see from your profile that you are a physician and you are a public health practitioner, and then you are involved in such professional work and with organizations. So, what motivated you to get into such deep work?
Okay. Let me start with the introduction. I'm
Mm-hmm.
Hadiza Magaji Mahmoud. I'm a medical doctor with more than 8 years clinical experience, and I hailed from Nigeria, Jigawa State to be precise. And I can say I started having my career interests right from primary school. You can understand, like, going to the hospitals, seeing how doctors here in Nigeria are loved by many, and seeing the act of humanity. Because I can say medical, like being a medical doctor, is that profession that makes you satisfied. So
Mm-hmm.
seeing the satisfaction, the happiness in the physicians, and how the patient's relatives, the patients are happy about the care they are receiving, I feel, okay, I think this is for me. Because anything humanity, anything community, anything that is giving is what I want to do. So I developed that passion, and my father really supported me in that. He really assisted me in that. And going through my secondary school, I decided to join the science classes, and then successfully passed and started my medical degree in Nigeria, which I concluded. I became an MBBS holder. We call it MBBS in Nigeria. That is Bachelor of Medicine and Bachelor of Surgery. And then from there, I proceeded to my internship. From internship, I did my master's in reproductive health. Then I started my specialty in obstetric and gynecology in Nigeria, that is in Kano, that is Aminu Kano Teaching Hospital. So during the course of my obstetric and gynecology journey, I saw that as a physician or a clinician, obstetrician, I can impact only at individual level, not at community level. So I decided to, like, no, I think it's time for a career switch, which I then decided to join the London School of Hygiene and Tropical Medicine to do my Masters of Science in Public Health. And then from there, I took up the journey as a public health specialist, which I am now a trainee with the West African College of Physicians, serving the role of a public health specialist as well as a clinical physician. Yes, and my zeal for, like, continuous learning, professional development, being connected to like minds. Then
Mm-hmm.
I became a member of reputable, prestigious bodies of public health, both across Nigeria and United Kingdom at large. And I'm looking forward to exploring more memberships across the global world.
That sounds so wonderful, and it shows how ambitious you are. It takes a lot to get into healthcare, and at the same time, just going on with the education and developing yourself, going into public health. I think this is where we are similar because I also did my master's in public health, and I chose public health for the same reason. My undergrad was in pharmacy, but I
Hmm.
realized that I did not want to go into pharmaceutical industry because that was something I feel it can be controversial, but I'm not shy to talk about it. I feel like medication, they don't really heal you. They suppress the symptoms a lot of the times. There has to be some other way of helping people. And I think public health kind of gives you a more wider sense of
Exactly.
helping communities. I mean, medication in some aspects is very helpful. We need it, but not in every case. If you have a fever, you're given medication. If you have a cough, you're given medication, although it's going to be healed in a few days. But that's the abuse, that's abusing medication. And that's also people getting abused. That is where the line is drawn. How do you differentiate between using and abusing? You're in Africa right now, right? So how do you see
Yes.
the differences in acceptance regarding the taboos about reproductive health in Africa and in UK? Because you definitely have seen both.
Yes. I think
Yeah.
I can tell you this is one of the challenges I'm currently facing
Mm-hmm.
in Nigeria because when we are talking about reproductive health, sexual and reproductive health, because they are just like twin sisters. So when you're
Yeah.
talking about sexual and reproductive health, I think it's like it doesn't really exist in Nigeria
Mm.
because it's silent, especially when it comes to like a specialization. You can do a residency training only in obstetric and gynecology, or maybe you go into public health. But under public health, yes, we have a subspecialty that we
Mm.
call like the reproductive health per se,
Yeah.
but it's not really in depth. And the reproductive health is not outspoken, is not like visible, like
Mm.
you said, because of the taboo, because of the stigma. And looking at Nigeria as a country that consists of different cultures, different religious background. So
Mm.
in some cultures, it's really a taboo to be talking about sexual and reproductive health issues. And also in some religion,
Yeah.
especially let's say in Islam, you can't really come out in public to be discussing maybe intimacy issues. And some of our scholars are not really like supporting maybe the idea of contraception, all those things there. So, issue of sexual and reproductive health, I can't even say that we even have a center, a national center that is even looking after all those sexual and reproductive health issues. And I think that's draws me closer to having that passion of being a
Yeah.
sexual and reproductive health specialist because I believe in this world it's all about new innovations. It's all
Mm.
about bringing new ideas, and it's all about really looking at the problems the societies are facing and trying to tackle them. Because when we
Mm.
are talking about population, you can understand that Nigeria is one of the highly populated country with more than 220 million individuals. And
Mm-hmm.
looking at the North in particular, where I'm coming from, seeing that our religion really supports the polygamous nature of marriage. So you can
Mm.
see that there are lots of wives, our fertility rate is extremely high. So there's no
Right.
way we can say we want to shy away from reproductive health issues and
Mm-hmm.
some reproductive hazards, like practices like the female genital mutilation, which is
Yeah.
almost like allowed in our culture. And
Mm-hmm.
again, looking at like teenage, early child marriages, like teenage pregnancies, like unsafe abortions with its complications, looking at multiple pregnancies again with their complications, and looking at our economic status in Nigeria, that even our poverty rate is very high. Only
Yeah.
few people are even living in $1 per day. You can understand why I think the issue of sexual and reproductive
Mm.
health must really be given a priority. And I
Yes.
believe maybe with people like me, maybe even people like you, not even really from Nigeria, I think
Yeah.
if I can have the support of other people that are really interested in bringing change to the community,
Mm-hmm.
maybe my voice will be heard when it comes to sexual
Yeah.
and reproductive health matters in
Mm-hmm.
Nigeria, especially in the northern side of Nigeria. I think that even gave me the ambition and the
Mm-hmm.
passion to create my foundation, which is called the Health Project Hub. I think it's written there in my LinkedIn page, so as to start the awareness gradually to start bringing it up, nurturing it, maybe till it blossom. I'm sure sexual and reproductive health issues will really, really bring a change to all the crises we are facing in Nigeria.
Hopefully. And I totally agree with you. Every point you're living there and you see it up close. And I think this is such an important issue for us to understand, especially people who are not living in Africa. Back in when I was doing public health, I had a course on women's health. I
Hmm.
chose it on purpose. And I studied a lot about African communities, Asian communities, and Malawi. It was so painful. I cannot
Hmm.
imagine what women are going through over there. It is actually our responsibility to take a big
Hmm.
step to do something for them. And I feel it's more about culture than religion.
Hmm.
Because even if you see in the hadith, how do we know how Prophet Muhammad sallallahu alaihi wasallam was with his wife Aisha radiallahu
Hmm.
anha, right? Because she used to say it. She was a scholar and she used to
Hmm.
tell them that, he was intimate like this. He used to be so romantic. He would stop an army for me. He would, do so much for me. How do we know this? Because his wife said it. So I feel like even he used to talk about it. Prophet Muhammad sallallahu alaihi wasallam used to talk about it. But in our culture and society, we have blend religion in a way that we have incorporated what we want from it and we have deleted what
Hmm.
we don't, especially the rights of women.
Exactly.
Women's rights have been depleted, although in Islam, women are the queen. Women are treated so beautifully. But in today's culture, we don't see that. And also FGM. This is something I really want to talk to you about because when I read about this and while I was doing my course, it was painful to even read about it. And some women go through it.
Yeah.
So, is there any
Yes.
way to see that how can communities ban these practices?
Okay, so talking about that,
Mhm.
from my experiences, I like living and practicing in the northern Nigeria. I
Mhm.
believe anything that you want to do, let's say if you have any policy, maybe to abolish the practice of FGM
Yeah.
among our younger females, it needs a multidisciplinary approach where you
Mhm.
have to really engage with important stakeholders within the
Yeah.
society, like our religious leaders, our
Mhm.
cultural leaders, our ward heads, and also to involve the politicians, because as we all know, Nigeria is under politics. So you have to involve a well-known politician that can really support you in that journey. So
Mhm.
maybe like raising awareness, providing
Yeah.
health education on the dangers of such practices, and even
Mhm.
telling them like what are the practices really meant for? Is there any benefit? Is it that they
Mhm.
are just doing it for culture to maintain that cultural standard? Or no, they are doing it for a particular benefit. So like
Mhm.
there has to be like an interactive discussion between those important stakeholders so that both maybe I and them or any of the organizations in charge of that should arrive at the same on the same table and understand the real harmful effects of the FGM and
Mhm.
like inviting them, getting them like collaboration from those stakeholders will form like a team so that we'll have an effective teamwork in order to bring out some policies that are really going to abolish such practices. And some of the policies can be maybe, yes, involving even some of the community members, even the parents of the
Yeah.
children that are exposed to such harmful practices. So I
Mhm.
just believe like it's more like creating a policy that is really going
Right.
to abolish such practice and even showing some examples. Maybe if we have records from the hospitals of such individuals that had complications from the FGM, we can really show it to the community that this FGM practice is not even doing any good, rather is doing harm, and we could really prove it. So there's going to be like an evidence. And to get that evidence, I think we can even back it up with the research if we can, maybe to
Mhm.
go into the communities, to engage in some projects, research work, so as to know what's even exactly the prevalence of such
Yeah.
female genital mutilation and to assess some of the harmful effects like immediate complications from such procedures, and then later on late complications, so as to bring something that is evidence-based in order to inform those policies for effective decision making and implementation of policy that is going to abolish such practice.
Right. It makes sense, of course. It is a very long process. It has been going on for centuries, and it actually has no benefit to the human
No
body, to the
benefits, yeah.
female body. And it is painful when they reach adulthood, when they have babies, the complications only increase. Women die, and I cannot imagine the pain they go through. It's not normal, it's not something simple.
Yeah,
So, as humans, as women, I think everybody will understand the pain of doing something that unnatural to a human body and living with
exactly.
it.
To that.
Yeah,
And since we are talking about mental health, I believe when we're even talking about the mental health of such victims, we can
exactly.
just think about how their mental health is, because
Exactly.
it's really devastating, like a lot of things involved there. Yeah, so
Mm-hmm.
it's doing more harm than good.
Exactly. They are experiencing such physical pain that
Mm,
it's not distinguishable anymore. You cannot distinguish the mental and physical pain anymore. So it is a very painful reality that we live in. And the fact that when I talk about this with my friends, that FGM, this is a practice, and they didn't know about this. Other parts of the world, we don't know those things. We are just unaware. It happens and it exists. So have to work on your mental health. Like, how do I say that to them when they're seeing that this is happening to themselves and their daughters and other women? How do you actually tell them that, oh, it's going to be fine? There has to be some kind
yeah.
of hope for doing that. You're seeing all these things. How does this impact you? You are a professional, but you have to be very used to it to be able to handle it emotionally.
Yeah, exactly. And like you said, like I think um um maybe in other worlds, the European world, maybe I don't know, even the Asia, people are not really aware of the practice. I could
Mhm.
remember when I was doing my Masters of Science at LSHTM, and we were given an option to write on an essay, and I decided to write a paper on female genital mutilation in Nigeria. And when I was presenting the paper, a lot of them were surprised, like, what is female genital mutilation? Like, what's the benefits? Why are
Mm-hmm.
Africans really like involved in such hazardous procedure? Why is
Yeah.
the culture supporting all this? I think I turned to be like I was the lecturer that day, because I was lecturing them, telling
Yeah.
them more about it and
Mm.
the implications and how it's really affecting the women that is the
Yeah.
victims. And I was telling them, it's like, I don't know whether in Nigeria yet we have any policy that is really
Mm.
looking into the abolishment of such
Yeah.
practice. But I don't know, maybe in the future, like I said, if you will be conducting several researches, especially those that are really pointing out the dangers and the hazards associated with such procedures, maybe then Nigeria will see it as really a case of public health concern, and they
Mm-hmm.
can do something maybe about it. Just like of recent that the Nigerian um, Ministry of Health
Mm-hmm.
launches the new national policy on menstrual health. So I
Mm-hmm.
believe, so before in Nigeria we had no such law, no such policy, but recently in August it was launched, because they believe menstrual hygiene should be a right for
Mm-hmm.
every lady, especially in secondary schools. As
Yeah.
such, Nigeria is now trying to embark on such journey. So since
Mm-hmm.
things like that can now be implemented, I believe maybe with time, if we get more people interested in the issue of FGM, maybe the Nigerian system will really incorporate such new policies that will really look into the matter of female genital mutilation. So I can say we still have hope as long as we are raising our voices.
Exactly, exactly. And this is the whole point. That is why you are doing what you are doing. You have so
Yeah.
many degrees and went from Africa to UK to do some good for your people and for whoever needs it. So, how do you actually see the mental health of these women, not just the women going through FGM, but also other women around you? Maybe how do you see the mental health and personal behavior about reproductive health from women's perspective?
Okay, I can say ever since I started my reproductive health journey, I've been very interested in mental health issues.
Mm-hmm.
And that brought me back again to one of my research,
Mm-hmm.
which I did on the consequences of infertility
Mm-hmm.
on mental health status of women in low middle income country. It was a systematic study where I was able to see how infertility is really affecting the mental health status of women.
Mm-hmm.
And I had interest, or let's say passion about that when I was in the clinic,
Yeah.
seeing how women suffering with infertility are left devastated, hopeless, feeling not enough, and
Mm-hmm.
living with the stigma of maybe not being able to bear a child and being blamed even by the husband's relative, the society. You can imagine that, like being called all sorts of names, not even hearing from them. So I
Yeah.
was feeling like, okay, as a gynecologist, then doing my specialty program, what do I have to offer? Like,
Yeah.
all I have to do is just to treat the woman,
Mm-hmm.
which this treatment, maybe some is not even some sort of infertility you can really treat. Maybe some cannot even afford to go for any IVF, any artificial fertilization, and the rest of it. So they were just left with no option rather than again going back to those societies, going back to that family that are calling them names, that are stigmatizing them. So, like, since then, I had that in mind that we really, really need to have some mental health facilities
Mm-hmm.
incorporated in our clinical units. Like,
Yeah.
not to talk about maybe having a psychiatry ward or maybe having a psychology department. No, not like that. I mean, we have to incorporate some mental health facilities in each department. I don't know if
Mm-hmm.
you're understanding my point. Like, for example, now if you are dealing with geriatric cases, old
Yeah.
cases, those that are
Mm-hmm.
having all those chronic illnesses, heart
Yeah.
diseases, diabetes,
Mm-hmm.
neurological deficit disorders, and a lot of them, they need more than clinical care. They
Yeah.
also need some psychological intervention there. They need some mental health therapy there. And
Exactly.
also to think about our cancer patients that are on chemotherapy or they are on radiotherapy. You can imagine how devastating such diagnosis is, and you can understand what complications comes with the treatment of
Yeah.
radiotherapy,
Mm-hmm.
chemotherapy, and the rest of it. And you can understand how financially they will be depleted because of
Mm-hmm.
such. So I believe they cannot embark on that journey enough. So they need some sort of mental health therapy incorporated in that
Mm-hmm.
post radiotherapy or chemotherapy or whatever. The same thing
Mm-hmm.
applies to the infertile couples. I believe they also need some mental health therapy sessions so as to
Mm-hmm.
calm them down, to explain things to them so that they will feel loved. And
Mm-hmm.
again, to help with their maybe mental health instability, it's also important maybe to create some supportive group of
Yeah.
individuals like that cohorts of
Mm-hmm.
infertile couples or women, so as they know they are not alone, they have their cohorts to discuss issues with, so that they will believe they are not like aliens.
Mm-hmm.
So I believe all this that I'm explaining is not available in Nigeria. And you said I should make comparison. So making that comparison when I was in the UK, I was surprised. Like my first visit at the NHS facility, I was seeing pamphlets, leaflets,
Mm-hmm.
about diabetic patients having a support group, cancer patient, having a support group, even after your visit, you have to fill in a feedback form and they will be asking like, are you depressed? Are you anxious? Are you having any post-traumatic stress disorder? And
Yeah.
I could see that their mental health facilities are really, really active. They
Yeah.
are alive. They believe like there's something called mental health issues.
Yeah.
But in
They do.
Nigeria, we don't really believe in mental health issues because
Mm-hmm.
of our culture, because of the
Mm-hmm.
society. Once someone is maybe showing some signs or symptoms of depression, anxiety, maybe PTSD, bipolar disorder, then we'll be thinking about spiritual.
Mm.
Next thing, it will be like, no, 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 no.
Mm.
This is a spiritual attack. And the
Yeah.
next thing is what? To go and look for a scholar, to go and look
Mm-hmm.
for a pastor in the church, to
Yeah.
start thinking about, no, this is a spell, no, these are genes, all those things.
Yeah.
So
Yeah.
they
Yeah.
are not, their mind is not even going straight to the mental health disorder, not even
Mm-hmm.
to talk about maybe offering some sort of mental health therapy to such
Mm-hmm.
victims. Rather, no, straight to spiritual. So
Right.
that is
Yeah.
why when you look into our
Mm-hmm.
society,
Yeah.
especially the northern society, you will
Mm-hmm.
have more of those spiritual homes than the
Right.
mental health homes.
Mm. Okay.
Yes. And apart
Mm-hmm.
from that, there's this stigma. So even if, let's say, I, as a practitioner, I
Mm-hmm.
believe, I feel, maybe, no, 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 this person is not really having a spiritual attack. Maybe this
Mm-hmm.
person is having some sort of bipolar disorder. Maybe someone is having an
Mm-hmm.
anxiety disorder. And I
Yeah.
try to maybe advise that, no, this person should be taken to the psychiatrist for evaluation. So, because what we have here in Nigeria is called the psychiatric hospital, you understand? So, even
Okay.
from the name, so people will
Mm-hmm.
be like, no, this person is not mad. This person
Yeah.
is not crazy. So, why are you
Mm-hmm.
advising us to take the person to a psychologist or maybe to take the person to a
Mm-hmm.
psychiatric hospital?
Yeah.
Because this person is not mad. So, there's that stigma attached. So it will be like,
Exactly.
okay, so if someone is displaying some sort of mental health issues and we are taking the person to the psychiatric ward or maybe the psychiatric clinic, then the person will just be labeled a
Yeah.
psychic.
Mm-hmm.
So there's even that stigma being associated with that. And thirdly, again, like I said, Nigeria doesn't really have such mental health therapy centers. Rather, maybe we just have a neuropsychiatric center
Mm-hmm.
where they only see some advanced form of mental health crisis
Mm-hmm.
because they believe they are emergencies, because they can even pose a threat to the
Okay.
people living around the victims. So then that is when they will now believe in quotes that, okay, so this is a mental health issue and need to be addressed at the neuropsychiatric hospital.
Mm.
But
It
for
has to
some
be
like
just.
just yeah,
Yeah.
for some mild mental health issues, no, 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 no. It's spiritual, it's this, it's that. So I can just say, even despite the fact that Nigeria is having large burden of
Mm-hmm.
people suffering from mental health issues,
Yeah.
due to the fact that you can see the financial crisis the country is in, the economic crisis, poor governance, and even our health seeking behavior also contribute to that. And we have a lot of our youths that are really involved in substance abuse. We have homeless people living in the streets. So a lot of issues are really contributing to our mental health, which I feel, especially among the youth, we have a lot of school dropouts and even a lot of people not even enrolled in schools
Mm-hmm.
because of the nature of the system. So a lot of people are left with their mental health crises that are not even identified. So we have bulk of mental health burden in Nigeria, but unfortunately, because of maybe the factors I've explained earlier, they are not really looked into.
Yeah.
And again, and a lot is not being done in order to tackle such. But maybe with the mental health awareness days, and the rest of it, I still believe, because I can see now in some of our like TV stations, radio stations, some of our psychologists and psychiatrist professionals, used to do like some of these mental health talks. And I
Mm-hmm.
believe maybe again with time, Nigeria will really look into this issue. And if we try to maybe conduct more research on
Mm-hmm.
issues related to mental health, and if we could really bring it out to present those evidences for the policy makers, I believe Nigeria will really take it into consideration and implement maybe a very fair
Yeah.
policy in trying to address such issues.
Yes, we definitely can hope and we can definitely work for it.
Yeah, yeah, yeah.
My direction of going to mental health was kind of similar. What I observed is that not everybody needs sleeping medication or medication at all. But in Bangladesh, a lot of times, if you go to a psychologist, psychiatrist, somebody is having a bit of depression or anxiety, they're given medication. And then maybe if they're given high doses or sleeping medication, then their mental health is worse. I observed it from a very young age. Even when I had certain mental health issues, when I was going through a difficult patch, there was nothing that I could look forward to.
Hmm.
There was not a well-being system. We rather need
Hmm.
a mental health well-being system, right? Not we don't need
Hmm.
medication. We don't need like a psychologist or a psychiatrist treating us.
Yeah, yeah,
We just need
yeah.
mental well-being so that we can speak to somebody or a group and we
Hmm.
can have
Hmm. Hmm.
practical solutions. When I was working in UK in mental health, we had a training. So during that training, it was a coaching training. It was a lot of interactive activity, writing, speaking.
Hmm.
Before the coaching, she told us that after this session, you will feel extremely tired because you're using so much of your brain. And
Hmm.
honestly, after the session, every single person was feeling drained. So it shows
Hmm.
that even in our daily life, we are not using a lot of our creative brains, our questioning brains. We don't question things, we are just going with the flow. So if there is a well-being environment where we can go and we can have discussion, we can have knowledge about what mental health is. People only see mental health as a disease. It's not. It's your
It's
mind.
not,
Mind
yeah.
controls your body. Yeah. And
Exactly.
and like you mentioned previously, having mental health in all the departments, that is very necessary because in every single treatment phase, a patient goes through a lot of stress. It's not like they're
Hmm.
mentally well, they're not, but their well-being is hampered. They are feeling stressed, they're feeling devastated, their family is
Yeah.
devastated. So we need well-being services for the patients and also for their families. So it
Hmm.
actually shows a lack where we could improve as societies, as cultures in Bangladesh. It is improving, but there could be so much more improvement. There could be so much more services to help people. And you talked about young people having drug addictions. Do they come to the hospital? What do they do?
Problem is, like I said
Yeah,
earlier, like
yeah.
Nigeria is
Mm.
having too much population,
Uh-huh.
and most of these people, I can say maybe that are having this issue of substance abuse are coming from the low privileged family, where you
Um,
can understand how even their health seeking behaviors are, and even having access to such
mm,
facilities. And again,
yeah.
looking at Nigeria, we don't even, like I said, have like a
Mm-hmm.
mental health well-being facility, like specifically for someone that is having any mental health issue that will feel comfortable walking in there, explaining his issues, and to be heard. Rather, we have what we call the psychiatric wards, where
Okay.
maybe only when cases are severe that
Mm-hmm.
individuals do present, or let me say their families do take them to the psychiatric clinics or facilities. So that is why I think we have, can I say, like we are missing out
Yeah.
on
Okay.
even those drug addicts. But you can see them on the streets, yes. You
Okay.
see majority of them on the streets by
Mm-hmm.
mere looking at their actions, looking at their appearances. Sometimes you even see them smoking, you understand? So on the
Yeah.
streets. So it is even telling you that majority of them, maybe based on experience or maybe what we are seeing in our societies, are not really presenting themselves into the clinics in order to even seek for help. Only maybe the
Mm-hmm.
privileged ones, maybe
Yeah.
those with good health-seeking behaviors, maybe their families are really aware of their conditions and are really ready to seek for maybe any well-being support, maybe then they'll present them to the clinic.
Okay.
So I think that is why Nigeria will really
Mhm.
have to look into establishing more of maybe mental well-being
Yeah.
centers so that the youths will feel safe and not to be judgmental
Yeah.
about maybe telling their issues to the caregiver and getting the necessary assistance. I think that will really reduce maybe the number of people on the streets with mental health issues.
Yeah. Definitely, definitely. Let's talk a bit about you now. I want to know how you handle your mental health. You are seeing a lot of issues in Africa. You are dealing with a lot of issues in Africa. You definitely have your challenges as well in your life that you definitely take on with grace. But how do you actually take care of your mental health?
Okay, so talking about challenges, yes, I know practicing in a developing nation, northern Nigeria,
Mhm.
seeing lots of cases that you feel are beyond your control. Maybe you
Mm.
want to do something to help the patient, but you cannot do it
Yeah.
because you have some limitations, some restrictions. And I think it's really, I think that is what is really affecting me, or what has affected me and is still affecting me. That
Mm.
is even before I went to the United Kingdom. So I decided, okay, I want to make a change. But how will I make a change? I would have to make a change maybe when I have within my cycle
Mhm.
people that are really looking at what I'm seeing and are really understanding my own point that, okay, no, this is devastating, this shouldn't be, patient shouldn't suffer this way. I think that is like what I said, like what really drives me towards
Yeah.
switching from the individual perspective to the community
Okay.
perspective. So I feel okay, so let me just maybe switch the career to public health. And when I
Mm.
went to the United Kingdom, I saw how things are being done in an organized manner. I could see how every individual has his own rights. I could see
Mhm.
how the government really prioritize its citizens and even the visitors there. I could see like things being done orderly.
Yeah.
And again, my mental health now began to improve. Like, okay, I'm now
Okay.
living in a place where maybe my voice will be heard, even from our student, what can I say, from our college, where whenever
Yeah.
you have any issue, we have the mental health well-being, what would I call them? Is it centers at London School of Hygiene and Tropical Medicine, where
Mhm.
you can even just log into your student accounts, you book a mental health session, you understand? Like you
Yeah.
discuss with them open-heartedly, like telling them about the stress, how you are not coping, how you're
Mhm.
missing home. So it's like you have someone to talk to. So
Yeah.
when you feel stressed, you have that place you can voice out to, and you
Yeah.
offer their advices and they offer all sorts of like help, and you feel really supported and comforted.
Yeah.
So I could say, yeah, so it improved. And then all of a sudden, when I was back to Nigeria, you can imagine that. I was like,
I can
God.
imagine.
So was it this system I left? I went to the
Mm.
United Kingdom and now I'm back into the system. Then
Mhm.
again, I began to think again, even though I'm doing it at community level. And then it worsens my mental health because I felt this community are suffering because the community are not even aware that
Yeah.
they even have the mental health issues. So you
Mhm.
can imagine, like, okay, how do you solve something which the person is not even having an insight on? The person
Mhm.
doesn't even know that he's having this problem, but yeah, the person seeing the problem for the person.
Mhm. Exactly.
So yeah,
That's tough. Yeah.
but I think what helps me now
Mm.
is I just decided to do more and do more and keep doing more. Like, even though, yeah, it's stressful, like, okay, I cannot do this thing alone. So I
Yeah.
decided to start maybe looking for people that will support me in this movement. And that
Mm-hmm.
was the reason why I brought about the Her Health Project Hub, which is really looking into issues of women, because I believe women are those that suffer from mental health the most, and they are those that needs our care the most, because looking at our reproductive cycle, looking at our life, bearing children, taking care of our children, is not easy. So women goes through a lot. So I believe, okay, maybe through that project, at least, since what is really making me stressed out is seeing things not done the right way, or maybe it's seeing people not being provided with solutions. So maybe I can try to do something by involving other people that
Mm-hmm.
are maybe my cohorts, like minds, that belongs maybe to the same cycle as me, seeing
Mm-hmm.
things the way I see them, and also try some sort of stakeholder engagement involving some relevant stakeholders, telling them about what the project is all about. So I think maybe since I've started embarking on such journey, it's really relieving me now. Like, I feel
Mm-hmm.
maybe at least I'm doing something in the society. At least some segments of individuals have been heard, some segments of individuals have been taken care of, and the solution have been provided. Then personally, when it comes to maybe work stress, yeah, I really like just to be alone, you understand, or maybe just to go on sightseeing, then
Yeah.
have a chat with the family, have fun, maybe listen to my children about their school runs. And I just like chatting, and I
Mm-hmm.
like taking fresh air. That really helps with my mental health. And I also like speaking to someone, maybe a close friend, maybe my husband, maybe my mom, to tell them like what I'm really going through. So once I
Mm-hmm.
speak to them, I feel relieved. I feel okay, I'm not stressed again.
Mm-hmm.
So I think that's how I manage both like work related mental health stress and other stress. Yeah.
That's wonderful. The funny thing is, in my last podcast with Ben, he's a director, he said the same
Mm,
things. And it is funny how people in different parts of the world they take care of their
mm,
mental health in the same way. I always say this, even when I was in UK, I used to say this to everyone, even in my interviews. I've realized over time is we are all same. We are all similar.
yeah.
Media divides us, or society or culture divides us. But as
Mm.
humans, we are all the same and we feel. Can you tell us a bit about your project regarding women's
Mm.
health? How did it start?
I just started it, like,
Oh,
from
did
my
you?
experiences, looking at how our women are being neglected, how our women are not being aware
Mhm.
of some of the issues really affecting them. I was watching from far that, okay, as women, this group of women are really aware of the dangers of what they are doing. They might not have done it. So then that brought an idea of, okay, so what if you decide maybe to sensitize them, maybe to raise awareness of the dangers of what they are doing in their day to day life? Then you might really make change
Mhm.
into what is affecting them. So I just brought it up
Mhm.
and started running it at individual level. I got registered, got licensed, and then when I even wanted to go for my very first community outreach program, which was on giving some birth incentives in order to, like, we call it like delivery packs, where you can give some umbilical cord clamps,
Mhm.
sanitary pads, baby
Yeah.
pampers, methylated spirits at hospitals. So I decided to do that in order to help our women. And then I gave a lecture on an emergency birth preparedness and complication readiness, which was also part of one of my research work that I did in northern Nigeria to assess how well prepared our women are during pregnancy and to really gauge their awareness of complications that may arise during that pregnancy and how ready they are to take care of those complications. So that was even the reason why I decided, okay, to take that very first move. And I went to the primary health care center and I was able to support with those delivery packs, leaving the women happy, well educated, well aware of key danger signs of pregnancy and how to prevent them, educating them on the 3 delays of maternal mortality because maternal mortality is high in northern Nigeria. So yeah, so from there, then continuously delivering lots of education, raising awareness, giving aids to women and adolescents, and we'll be doing more. And I'm looking forward to collaborate with more people locally, nationally, and even globally. So I think I can see the future of our health projects, hope not even in Nigeria, but across the globe. I think with those little changes, we can cumulatively achieve something broader.
Definitely you can,
Yeah.
especially with your knowledge and with your drive, it's possible. It will take time, and I think good things take
Yeah,
time,
it
as the
will.
saying goes. But the way that you are progressing, the way it's very inspiring. This journey would benefit so many women, so many people. Like at the beginning, when you were talking about infertility issues, their families also need mental health well-being sessions. Their family needs to know
Exactly.
that it doesn't depend on the women all the time. And even if it did, there are other ways. There are so many complications. So the families need mental health sessions. The patient needs mental health sessions with people like you working
Yeah.
for it. There will definitely, inshallah, be change.
Yeah, and to add to that, and part of my project, I also do offer some sort of mental health therapy, mental health well-being sessions, and a lot of it. Like once we see the women in need, we don't just like help, but we rather invite them for a session and offer advices. Yeah.
Yeah, that's really good. So this project is a complete project in itself regarding everything, health, mental health,
Yeah, yeah,
well-being. So that is truly
exactly.
inspiring. Honestly, you're doing a lot and it is amazing to see that. So I still have one question. That is, if you could
Okay.
give one advice to the young professionals around the world, what would that be?
I think my advice would be believe in yourself,
Mm-hmm.
have a bigger vision, a bigger dream, and believe that yes, your dreams are valid and you have what it takes to achieve that dream.
That is
It might
amazing.
it might take time, like you said.
Yeah.
Yeah, but just believe in yourself that
Mhm.
you are capable of making that
That's
change. You are capable of achieving that dream
mhm.
and you walk towards the pathway to achieving that dream.
That's an amazing advice. People lose hope.
Hope they give up, yeah.
And I actually say that I don't think people even try as many times as I have failed. And I think that is where well-being comes. If you are mentally strong, if you know that you're having this issue, and if there is somebody, a professional or somebody that you trust, can tell you otherwise that it's fine. It's fine if you fail. It's fine if you
Yeah,
are feeling very down right now. Just go on. You are more capable than this. And anything else that you
exactly.
want to add for anyone to hear, the people to hear about mental health before we end the conversation?
Yeah, I think I would just add a little about the failure there.
Mm-hmm.
A lot of people think maybe they failed because they are not enough.
Yeah.
Maybe they failed because they feel incompetent. But I believe failure is also part of experience.
Mm-hmm.
And failure is a lesson because failure will definitely teach you maybe something you've done wrong, maybe something you should have done, or maybe something that shouldn't be done. So
Mm,
also I believe failure is more like a lesson. So you
mm,
just pick it up, own it, embrace it,
mm,
and look at the loopholes. Look at
mm.
what really made you fail. Then you retry. Try it again. And I'm sure one is going to pass with flying colors. But some people, like, once they fail, they believe maybe it's over, it's
Yeah,
devastating, it's terrifying, the experience is not funny, and they might not really try it again. But go
yeah,
for it. Like, give it a trial. Try it, do it. And another thing is fear. A lot
yeah.
of people are afraid of starting. A lot
Mhm,
of people are afraid of the failure. And a lot of people are afraid of what the world would think about them. And a lot
mhm,
of people are afraid of maybe starting small. So they will
mhm.
think maybe just this small step will not really take them anywhere. Maybe when they are comparing with other people that have grown bigger, not knowing that those that grown bigger also started with those small
Yeah,
steps.
yeah.
So I
That's-
believe one should just embrace the journey and
mhm,
trust the process and be
mm.
patient, resilience enough, and also learn from every lesson. Yeah, so I think that's it. And lastly, maybe talking about the easy part. I don't know
Mhm,
if it's common in your
mhm.
area, but here in Nigeria, we can see that our youth are really, really embracing the easy pathway. They don't really
Mhm.
want to maybe work for that thing. Maybe they don't want to really give in their all for that thing, but they just want maybe that thing they are looking for just to grow overnight. There's
Yeah.
not that patience of
Mhm,
waiting. They just want it so easy and fast.
mhm.
And I believe for
Yeah.
everything that really have impacts, then that thing must really,
Mm.
really be given enough attention, enough
Yeah.
energy, and consistency, I think should be what will really lead to that impactful change. So maybe if our people would really maybe think about not being too fast and easy, but rather
Yeah.
trusting the process and being patient enough to walk it through with all the hard work, determination, and dedication until they achieve what they want to achieve. And also
That's it.
looking at mentors, collaborating with mentors, learning from them. Yeah, it will also help a lot.
That's fantastic.
So, my question to you, I
Yeah.
don't know how the states of, even though you said something about it that is now
Yeah.
improving in your area,
Mhm.
but like, um, when you compare it to the United Kingdom, how is it like?
It's very different, and that is why I'm working so much regarding mental health.
Mm,
So while we were talking about not giving up and starting small, I was actually thinking that starting this podcast is such a big deal to me. I'm not a social media person, and I do not like to come in front of camera. The reason I got involved was because of my mental health journey. I also am very focused with helping people in Bangladesh or the community, not just through this podcast or not just through international collaborations. I'm also
mm,
reaching out to schools in Bangladesh, organizations to incorporate mental health well-being as their curriculum. In
mm.
UK, they have mental health well-being services for everything. I was a mental
Yeah,
health
yeah.
coordinator, and I had
Mm,
mental health services for myself. And
mm,
here
mm,
we don't have that for adults or children's. And in UK, the program of the school itself is like that they take care of mental health well-being of children already. Children are well taken care of. Whereas
mm,
here, it's just a lot of pressure of getting good grades, getting the best grades, being the
mm.
top of the food chain. But what about the child's well-being? What about that youth's well-being?
Exactly.
It's not taken
Mm,
care of. So what I'm
mm,
trying to do here is trying to reach out to schools and especially organizations, charity organizations,
mm,
NGOs, if they're able to incorporate mental health well-being in their curriculum, because I think this session needs to be there at least once a month. We study every single day to pass a course. We study for 4 years for a degree, 5 years for a degree, and then we keep studying. Give a session to a person for one day for maybe 3 or 4 hours, and then you expect them to be mentally well for the rest of their lives. It's not gonna happen.
Mm-mm.
You have to
Mm.
give them stability, like you're giving them education.
Exactly.
Yeah, like you're
Mm.
giving them all this exposure to social media. Social media can actually make
Mm.
you mentally very unwell. You're seeing the lives of
Exactly.
this
Mm.
perfect people having everything, but social media can make you very unwell mentally, and that can make you physically unwell. So having
Mm.
this curriculum, having this system change is very necessary, especially for schools, especially for youths. Imagine those workplaces filled with toxic
Mm.
people. They were treated badly
Mm.
when they were youths. So this is like a cycle. If we don't do anything for it, it will just keep repeating. So anyone, I would say anyone who is thinking of breaking the cycle, they should come together. They should do something. That's where
Mm.
we all align, because everyone that I have been speaking to, they all want change.
Yeah.
Hopefully it will improve.
I can see that you have a very impactful project ahead of you,
Well,
and
hopefully.
it's really going to change the
Yeah.
narrative of mental health well-being in Bangladesh. And like you said, coming together will
Hmm.
really amplify change and is really going to have an impact.
Hmm.
And we keep working towards that, keep working towards the change, even though it might not really reflect now, it might be
Yeah.
slow, but I'm sure with time it will yield good results.
Yes.
Yeah,
And we
so
will
keep doing
definitely
the
see
good
each
work.
other's work. That's
Exactly.
really,
Yeah.
yeah, amazing.
Yeah.
And we definitely
Yeah.
would collaborate on a bigger level, inshallah. Exactly. It was lovely speaking to you. I had an amazing time. It was very insightful. I think I spoke about everything that I wanted to talk about. So it's really good to
Okay.
see that. So yeah, thank you so
Oh,
much, Dr. Hadiza, and it was lovely
I
talking to you.
understand.
So
Okay.
we will definitely keep in contact and see you soon. All right.
All
Bye-bye.
right. Thank you.
Bye.